Friends, I am Dr. Pawan Sureka. I am practicing pediatrics for last 40 years in Mumbai. Few days earlier, a mother called me. My child is 7 months old and she had a fall from bed. Child is excessively crying and mother was in panic. Doctor, has something happened to her brain? Is my child serious? Now when this happens for the first time, I usually ask the parents to come and soak. But then how do we assess such a child? When I examine the child's crying at stop, child is conscious, child is alert. I asked the mother, can the child recognize you? She said yes. Does the child respond to her name? Mother said yes. Then we look at the eye movements, face movements, all folding movements. Everything is fine. There is a small depression over the skull in a small child, which is called anterior fontanelle. It is an open soft space which is there with nearly all of us at that age. Usually it is like a tea saucer plate. But if it's bulging out, that means there is something collecting inside, one gets concerned. But if that is like a tea saucer plate, nothing to be worried about. Now, how do I explain to parents? Usually I say, see, in my room, if my room AC, lights, fans are working properly, it implies that the electrical supply or this electrical button switchboard is quite okay. Then there is no need for an electrician to go inside, open all the switchboard and check it. Similarly, if your child is conscious and alert, has good eye movements, has good facial movements, is knowing all the four limbs well, there is no need to worry about. The next question is, does the child require a CT scan? The same explanation, that if child's movements are fine, child is conscious and alert, there is no need for a CT scan of the head. Other question is, why did this child have a fall? Now in kids, accidents are quite common and they are related to development of the child. Usually around 4 to 6 months of age, kids start turning over. When this happens for the first time, number of times parents are not even aware of it. So they leave the child on the bed with pillow all around. Still the child manages to topple over the pillow and have a fall. So to avoid this, once the child has crossed 4 months, we must take care that the child does not have a fall when the child is turning over. The best way out is that when you are not around, leave the child on the ground with a good mattress. That can save this sort of a panic. Thank you.